Greetings. Today I'm going to talk a bit about the largest food-borne and oyster-borne outbreak that occurred in Florida, and that in fact was related to the unintended effects of cultural phenomenon, namely eating oysters as a way of celebrating the New Year's. In January 3, 1995, the Florida State Health Office in Tallahassee was notified of numerous clusters of illness from the Jacksonville County office that were presumably associated with oysters eaten over the New Year holiday. We began an epidemiologic, environmental, and laboratory investigation to determine the extent and etiology of the outbreak, to see how many people were involved, the source of the oysters, which part of the bays they came from and how they were transported, and how they may have been contaminated, risk factors for illness, and whether types of cooking might have in fact impacted the risk of illness. We conducted a retrospective cohort study of ill and well participants in 38 separate gatherings, or 38 clusters. We did a cross-sectional community survey of harvest area residents in Apalachicola. We did an environmental study, water quality, and the tide analysis to get an estimate of the quality of the water in the harvest beds. And laboratory analysis of patients include stool and blood. This is a picture from that investigation, including my co-investigator, Carlos Aristigueta, standing on an oyster boat, holding an oyster rake, and you get a sense of what the boats are like and that the facilities are not extensive. We identified 322 persons. Of the 223 oyster eaters that attended these gatherings, 129 became ill, for a relative risk of 22 compared to 2 of 76 non-oyster eaters. All patients experienced nausea, vomiting, and diarrhea. Over 50% of these people had abdominal cramps, muscle aches, and fever. The duration of illness was 1 to 14 days, and 140 total patients, 16 of them saw a physician, and 5 were hospitalized. This is our epidemiologic curve, and what's interesting, one of the interesting things, is you see that around the time of eating, which is a very big event on New Year's Day, is to go to oyster bakes, although not much baking, and you see the incubation period of about 12 to 40 hours, and there's a huge explosion of cases. It almost looks like a point source outbreak. The yellow are the cases that were in children of family members who became ill. So which oyster might be safer to eat, the raw or the cooked? In an interview of oyster eaters, we asked them to describe how the oysters were prepared, to quantify the number of the oysters that they ate, and to estimate doneness of cooked oysters. So we made a standard descriptive scale that we'll call the Kirkland scale, after Dr. Kathy Kirkland, co-investigator. And we stratified these into two groups: less done, which were oysters described as wet and slippery, or moist and juicy, and overdone, which were considered firm and dry, or tough and dried out. In looking at the results by preparation and risk of illness, those people who attended clusters, parties that did not eat oysters, were considered the referent, and only 2 out of 76 became ill. People that ate cooked oysters had a 79 out of 149 became ill, for a relative risk of 20. And it goes up to where people that ate exclusively raw oysters, 22 out of 31 became ill, for a relative risk of 27. So although risk was higher among people who ate uncooked oysters, cooking did not substantially improve that risk. In the risk of illness by degree of doneness, then, we considered overdone oysters to be the referent. And at that point, eating exclusively raw oysters conferred about 1.5 greater risk than eating overdone oysters. In our environmental and laboratory findings, we found that harvest area residents in Florida had reported a community outbreak of diarrheal illness in mid-December of that year, prior to the harvest. The pharmacies had sold out of Lomotil, and there were a great number of people children that had not attended school in the community. Harvesters and fishermen reported dumping human waste overboard, and that it was common among persons using the bay, and had increased during the illness. And the harvest time prior to the New Year's Day, which is the biggest time of the year for them, was described as stem to stern in boats. In just you could walk across the bay from boat to boat. In looking at the stool samples of people who were ill, we found small round structured viruses, and those are now known as norovirus. These were tested with reverse chain transcriptase, a polymerase chain reaction, and we also tested for paired sera and looking for a four-fold rise in antibody titer to Norwalk virus, and that was consistent in a few of the people that we could test to see a rise. This is a picture of the norovirus. In the timeline of events, we see from about mid-December on into January, the entire time the water quality was considered acceptable using the water quality monitoring that occurs in various parts, and that uses fecal contamination as its indicator. And of concern is that the entire time that people were harvesting oysters and then later becoming ill, the water quality was considered acceptable. So the peak outbreak in the Apalachicola community with dumping a virus overboard with feces and urine was during a low tide situation onto the oyster beds. Then we have the harvest for the new year. Now oysters, in fact, suck up gallons of water a day and can concentrate that. And almost a kind of cleaners of the bay waters. So in fact, they would concentrate the virus. These oysters were harvested for the new year and shipped all over Florida. The New Year's Day parties occurred, and the peak of illness during the incubation period about 1 to 2 days later. The investigation started when the complaints came in. Apalachicola Bay was closed. As we did an investigation, it turns out that oysters are tagged, and so you can in fact find the tags of oysters that were bought from the stores where people bought them and trace them back to the parts of the bay. And so we were finding most of our cases from Apalachicola or Galveston Bay, all the way over in Texas. So as we traced the oysters that people ate using tags and dealer records, we found the majority of cases came from Apalachicola Bay for 29 out of 38 of our clusters. This is where the focus of our outbreak had been and ended up ultimately involving a great deal of Florida. There were some from Blacks Bay in Louisiana and Galveston Bay. And at this time that these occurred, between Christmas and New Year's, we were the monthly low tide. Now, one of the things that we know is a problem in oyster tracing and labeling is that the tags are not always put on in the most careful manner. So we're not positive that Galveston Bay has contamination, or if in fact that there was contamination was found because we looked for it, and that the waters are not as clean as we'd like. So in conclusion, Florida's largest outbreak of oyster-borne gastroenteritis, and this was the first associated mainly with cooked oysters, and helped us get a sense of how protective cooking would be. Contamination most likely occurred when human waste was dumped overboard into oyster harvesting areas during an outbreak of gastroenteritis in the harvest area communities of Florida. Cooking oysters did not prevent illness despite what people believe, and we found cases associated with non-Florida oysters, as I said, with the concern that there may be an endemic quality to this or poor labeling. This is in working with communities of oyster harvesters, this is a community advocacy poster that we made to try to get at some of the change in behavior that needed to happen. The other important thing was to add facilities on docks so that if people actually wanted to not throw their waste overboard and wanted to bring it onto land, they would have someplace on docks or very close to the docks where they could take their waste. Recommendations included to develop better indicators for viral contamination of water and oyster meat, because currently the only thing that is used is bacterial fecal contamination. Research methods to develop guidelines for processing and cooking oysters to prevent illness. There are other countries that use a method called depuration, which is to take harvest oysters and to clean them and keep them in clean water for some time, hoping that at a certain point that they will get rid of the virus that they have. It's difficult to isolate virus from oysters, so it's hard to know what the endpoint should be. Enhancing surveillance, particularly during periods of increased consumption, Thanksgiving to New Year in the South, might help get a sense of how much of a problem this is continuing to be. And then public health message about cooking to say that it may not necessarily be protective. Questions in our outbreak were additionally related to recent outbreaks that had occurred in Louisiana that demonstrated oyster beds could be contaminated from boats and sewage and pass illness to consumers, and that contamination would not be picked up by the typical water quality testing, and that measures to protect the public, such as cooking, did not reduce risk. More importantly, the chain of events that were described helped understand that the health of the community around the oysters in the harvest communities were also important to the communities of oyster eaters. Thanks. Enjoy your lunch.